What I've seen in my practice is that parents are especially good at ignoring their own pain. You are taking care of everyone else first. You make the appointment for your child, you schedule the dentist, you're managing activities, but your own heel pain gets pushed off for weeks or months. Heel pain is one of those things people try to push through until it starts taking over their life. And for a lot of the working parents that I see here in South Tampa, the hardest part is not even the first step out of bed in the morning. It's at the end of the day. You have been on your feet at work, you've gone to meetings, you've handled maybe patients, clients, responding to emails, running errands, there's school drop-off, school pickup, and then you walk through the door and your kids still need you. They want dinner, they want help with homework, they want to go outside, maybe they want to go on a walk around Hyde Park Village or down Bayshore, ride bikes, go to practice, and you want to be that parent, right? You want to do all those things, but every step at the end of the day, it just hurts. So today I want to talk about plantar heel pain, why it happens, what most people try first, and when shockwave therapy may be one of the best non-invasive options to help you get back to your life. What is plantar heel pain? When people say they have plantar fasciitis, they're usually talking about pain on the bottom of the heel. The plantar fascia is a thick band of tissue that runs along the bottom of the foot. It helps to support the arch and helps the foot absorb and transfer force whenever you walk, you stand, or you run. When that tissue gets overloaded, irritated, or if it starts to develop chronic tissue changes, it can become very painful. Most classically, people feel it with the first few steps in the morning when they're getting out of bed. They step down, they feel that sharp pain in their heel. But for a lot of busy professionals and for parents, it often shows up in another way, pain that builds throughout the day. You might feel okay at first, maybe a little bit of pain in the morning, but by the time that you've worked all day, you're standing in dress shoes, you're walking across the office, picking up your kids, maybe you're carrying groceries into the house all in one fell swoop, and you try to squeeze in a workout, by the end of the day, your heel is angry. And that's where it starts affecting more than just your foot. This is when it starts to affect your mood. It affects your patience, especially your patience with your children. It affects your activity level. It affects whether you say yes or no to the things you actually want to do. Why does plantar heel pain happen? Plantar heel pain usually comes from too much stress going through the tissue without enough time to recover. That can happen for a lot of reasons. It may be a sudden increase in activity. Maybe you started walking or running down Bayshore more often than you were. Maybe you're training for a race, adding pickleball or tennis into your routine. Maybe you just joined Orange Theory, you're doing boot camps, and it could even just be longer days on your feet at work. There are times when it's shoe related. Shoes that are too flexible, too worn out, shoes that are too narrow or not supportive enough can increase stress through the heel. Heel pain can also happen because of calf tightness or weakness. It can happen because of limited ankle mobility, faulty foot mechanics, or simply the reality of being a busy adult who does not get enough time to recover. What I've seen in my practice is that parents are especially good at ignoring their own pain. You are taking care of everyone else first. You make the appointment for your child, you schedule the dentist, you're managing activities, but your own heel pain gets pushed off for weeks or months. By the time that you finally come in, it's not just an irritated heel anymore, it has become a chronic problem. Most people do try out some of the right basic things before they come in. They buy new shoes, they stretch their calves, they roll their foot on a frozen water bottle, maybe they try over-the-counter inserts. A lot of patients will try taking Tylenol or anti-inflammatories. They avoid barefoot walking. They may even try a night splint that they got off of Amazon. And those things can absolutely be a part of the plan. They should be a part of the plan. In fact, for plantar heel pain, foundational care matters. We still want to address load, shoe support, calf flexibility and strength, and overall foot mechanics. Clinical guidelines for plantar heel pain support treatments like stretching, taping, manual therapy, foot orthotics in combination with other care, and night splints for patients who consistently have first step morning pain. But here's the problem. If you have already done the basics and the pain keeps coming back, or it has been there for months, we may need to move beyond just calming the symptoms. We may need to stimulate a healing response. That is where shockwave therapy comes in. Shockwave therapy uses acoustic sound waves directed into the painful tissue from outside the body. It's non-invasive, meaning there's There's no incision, there's no break in the skin, there's no surgery, and my favorite part is there's no needles. The goal is to stimulate your body's natural healing response in an area that has become chronically painful. For the right patient, this can be one of our platinum level, non-invasive options for chronic plantar heel pain. And one of the reasons busy parents and working professionals like it is because it's quick. You can come into the office, the treatment is performed in a short visit, and then you leave. There's no anesthesia, there is no surgical recovery, and there is no cast. There's no downtime where you have to be off your feet for weeks at a time. You can typically go back to your normal day afterward, although we may want to modify some of the high impact activity that you're doing depending on your specific case. And all of this matters because most parents cannot just disappear from life for 6 weeks to take care of their foot. You still have to work, you still have kids you have to take care of, and you still have a calendar full of responsibilities. Shockwave gives us a way to treat the painful tissue while still respecting the reality of your everyday life. So who is this for? Shockwave therapy may be a good option if you have plantar heel pain that has been present for weeks to months, especially if you've already tried the basics. That means that you've changed out your shoes, you've tried stretching, you're using inserts, you're limiting your barefoot walking, or maybe modified your physical activity, but the pain is still limiting your day-to-day life. Shockwave may be especially helpful for someone who says, I can get through work, but I am miserable by the evening. Or maybe someone who says, I want to walk down Bayshore again without thinking about my heel or having to stop and stretch. For someone who wants to run, work out, play pickleball, but every time they try to restart, the pain comes right back. These are great candidates for shockwave therapy. Now, shockwave is not for every single person. We still need to evaluate you. Not every heel pain is plantar fasciitis. Heel pain can also come from a stress fracture of the heel, nerve entrapment, fat pad issues, or tendon problems. Sometimes arthritis can mimic heel pain, and there's other causes as well. So the first step is making sure we are treating the right diagnosis. What I want people to understand is that heel pain is not a small thing when it affects your whole life. It changes how you show up at work. It changes whether you want to park farther away. It changes whether you say yes to the family walk. It changes whether you can stand on the sidelines at your child's baseball game. It changes whether you have the energy to be patient at bedtime. And if you are a working parent, that emotional load is real. It's huge. You are already caring enough, and you should not also have to calculate every step because your heel hurts. So if you're here in South Tampa or Hyde Park, or maybe you're on Davis Island, and heel pain has been limiting your workday, your workouts, or your ability to keep up with your family, it may be time to get it evaluated. Shockwave therapy is quick, non-invasive, and it's designed to help stimulate healing without surgery or downtime for the right patient. If you are dealing with heel pain that has lasted more than a few weeks, do not just keep pushing through it. Schedule an evaluation so we can figure out what is causing the pain and whether shockwave therapy is appropriate for you. And if this video helped you, subscribe for more foot and ankle advice from board-certified podiatrists here in Tampa Bay. Comment heel pain below if you want us to make a video showing what shockwave therapy actually feels like during treatment.